A baby's nutrition is almost entirely the responsibility of the mother. Hi, I'm Rebecca Brayton and welcome to WatchMojo.com. Our host Veronica got the chance to speak with Nick Robinson about how to increase your odds of having a healthy baby.
So now that you're pregnant, what are some risks that moms need to be aware of?
Well, there are a lot of risks going into pregnancy. Upwards of 50% of pregnancies end in miscarriage within the first trimester. And then once you're past the first trimester and you're relatively comfortable with the safety of your pregnancy, there's all sorts of issues that can happen with the baby. There's, from fetal alcohol syndrome to low birth weight babies to deformities and birth defects, and so on and so forth. So there's a lot for a woman to be concerned about. And the best thing she can do, she can't prevent or guarantee that any of those things won't happen, but what she can do is take charge of her pregnancy and be very proactive and do everything possible to give herself the best odds possible to have a healthy pregnancy, a healthy delivery, and a healthy baby.
Are there any ways to help your odds?
Well, the most important piece is nutrition. So you want to make sure that you're rested, you keep stress low, you want to make sure that you're exercising and you're moving and you're getting your body ready for a healthy delivery. But nutrition is really the fundamental piece that you need to do.
Now, if you followed a specific diet while you were trying to conceive, do you just continue that diet now that you're pregnant?
Well, a fertility diet is very similar to a pregnancy diet. So you want to be detoxing during your pregnancy, obviously. So there's no cigarettes, there's no alcohol, there's no stimulants, there's no chemical foods or packaged foods. You want to avoid soy, dairy, gluten, things that are allergens or inflammatory that can prevent your body from absorbing nutrients. You want your body to be full of nutrients and proteins while you're pregnant. There are some essential things that you need to look for in your foods though. You need to make sure you're getting the calcium that you need for bone growth. You need to make sure you're getting the protein that you need to get the amino acids your body needs to build living tissue. You want to make sure that you're having omega-3, very important for development. You want to make sure you're having vitamin D, and one of the most important ones are the B vitamins. You want to make sure you're having a good supply of B vitamins because that prevents from neural issues.
Now, if you cheat and have a glass of wine or a coffee, will that affect your baby?
There's no known medication that you can take during your pregnancy. If you have a headache, you're on your own. If you have the flu, you're on your own. If you have some kind of infection, you're usually on your own. So if you can't put in any medication in your body, you probably shouldn't be putting in any substances like alcohol or caffeine or stimulants in your body.
Now, besides morning sickness, what other uncomfortable situations will a pregnant woman be in?
When you're pregnant, little by little, your baby takes up the space in your abdominal cavity where your other organs are. Your digestive tube, your kidneys, your liver, your stomach, your pancreas. And all of those organs are actually slowly pushed up into your chest cavity, which means that as you go along, the digestive issues not only become present, but multiply and become worse and worse. So towards the end of your pregnancy, if your digestion is really poor, have a lot of water and start spacing out your meals, making them smaller, more frequent during the day to help your body deal with the fact that all of your digestive system is now compressed in your abdominal cavity.
Now, if you're trying to eat healthy but you're nauseous, is there anything that you can do?
You can use that nausea actually as a guideline for putting in really, really safe foods into your mouth. But if you're so nauseous, you can't even stomach to have vegetables or good healthy foods, and the only thing you can do is try to prevent the nausea. There's some things that you can do. Ginger, for example, is a great way to prevent nausea. It's a natural anti-nauseant. The other thing you can do is take cinnamon. Cinnamon also has helped in some women to reduce nausea. You can also take small bites, small meals of bland, starchy food, like rice cakes, like rice crackers, like corn cakes or corn tortillas, things that are bland and will allow your stomach to calm itself down.
Now, what about food cravings? What if you're craving unhealthy food?
There's all sorts of different cravings. We all heard the pickle and the ice cream. Not the healthiest combination, but some things, aren't so bad for you. You have to remember, though, that if you can control your cravings and make better choices, do so. There are some cravings, though, that are out of control. Some women actually develop a condition called pica. And if you've never heard of pica, it's a really odd disorder where pregnant women start to crave non-food things to eat, like laundry detergent. So if you're smelling your laundry detergent and all of a sudden you have a craving to take a bite out of it, see your doctor. You probably have pica.
Now, are prenatal vitamins necessary?
Supplements are not a substitute, and so you should really look for a good vitamin to supplement to make sure you're getting folic acid, that you're getting calcium, you're getting vitamin B's, you're getting vitamin D, you're getting calcium. Look for a naturally food source based vitamin.
Are there any foods that moms need to avoid?
Yeah, there are some things that were maybe okay when you were trying to get pregnant, but now you definitely have to cut out from the first day of your pregnancy. So you want to make sure that you're not having any raw eggs, raw meats, raw fish, or anything that's undercooked. The same thing with deli meats. We want to make sure that you're not being exposed to bad bacteria that could harm your baby in utero. The other thing you want to watch out for is no artificial sweeteners. Artificial sweeteners actually cross the placenta barrier, and there is no known amount that is safe for your baby. If you see something on a label that has MSG in it, or yeast, which is another name for MSG, MSG is a neurotoxin. You don't want to expose your baby in the womb to a neurotoxin. Some other things you should be avoiding too are some of the fish that are high in mercury, like shark, like swordfish, like tilefish, and like mackerel. Those are fish you want to avoid completely during your pregnancy. Now, canned tuna fish is a pretty popular way of getting fish. You can have canned tuna, but maybe once a week, not more than that. But it's recommended to have a lot of different types of fish and seafood during your pregnancy to get a lot of the omega-3s. So you can go ahead and have several portions of fish during the week, just not from the ones we've just discussed.
Are there any chores that moms should avoid doing?
Well, a lot of women go and start preparing the nursery. So you should probably let someone else paint your nursery or varnish the floors or do any of that stuff that would expose you to harsh chemicals. You probably want to stop cleaning with harsh chemicals as well. If you have a cat or an animal in the house, don't change the litter anymore. Get your spouse to do it. You have a good excuse. Might as well use it to avoid the cat litter altogether. That can cause some serious toxic reactions as well.
Now, is there a natural weight gain that women need to be aware of?
Absolutely. So you want to make sure that you're gaining the right amount of weight so that your baby at birth is of a healthy birth weight. If you're underweight, you can gain from 30 to 50 pounds. In fact, some athletic women that just have low body fat but that aren't necessarily underweight should probably be looking at a much higher weight gain. You will need fat for the baby's development, but especially if you're going to be nursing afterwards, you will need a reserve of fat. I know no one wants to have an extra reserve of fat, and when you're pregnant, the last thing you want is to feel fat, but your body needs it, and your baby will need it when it's nursing. So you can be comfortable with the 30 to 50 pound weight gain if you're underweight. Now, if you're a healthy weight, 20, 30 pounds is normal. If you're overweight, however, I'm sad to say, you probably have to look at a much lower weight gain. You'll have to be really careful as you're going through your pregnancy not to put on a heavy weight gain because your baby will actually wind up being of a heavier birth weight. So most recommended are between 10 and 20 pounds for overweight women.
Do you want to leave pregnant women with any other advice?
Take charge of your pregnancy. Do everything you can. It's very empowering when you are in charge of your nutrition. You're in charge of your home, you're in charge of what you're exposed to, and you will give your baby and your body the best odds possible to have a fantastic delivery and healthy baby.
Thank you very much.
Thank you, Veronica.